Terrific. So, chairs Monroe-Moreno and Spain. So glad to be here with you to talk about this important issue that impacts probably all of us and our families. And as you know, as we all know, Black maternal health is something that probably does not get the attention it should. And we need to be lifting up this issue in our communities and among our families and friends because it is so important. I'm just going to dive in and say we know that Black women are 3 times more likely than white women to die in childbirth, but Black maternal health includes far more than just mortality. What are some of the biggest challenges you've seen or heard about for Black women in maintaining prenatal and postnatal health? Jump in, either of you first. Chair Spain? I should say jump in.
I think here in South Carolina, one of the biggest challenges is access to getting that care. Here in South Carolina, because of our abortion bans, we are losing OBGYNs, and those medical students are choosing not to go to school here because they want to go to school someplace where they're going to be able to freely operate and take care of their patients. And South Carolina is a state that has also refused, the Republicans have refused to expand Medicare. So Medicaid, excuse me. So that has an impact across the state. We've got counties right now, I think it's 15 of them that don't even have OBGYNs. So one of the biggest barriers right now for women in South Carolina is that access. Before
And
we even get to affordability, is access.
Access, exactly. And I'll speak a little bit about my daughter who has just had my first grandbabies. And two
Congratulations.
struggles, thank you, two struggles she had. One, she wanted a doctor of color and had a lot of trouble finding one because we don't have enough folks who are entering the field and being encouraged to enter the field. And frankly, it's a field that doesn't feel safe for a lot of medical professions to enter, given the state of politics and the fear of having to navigate their way around the abortion laws in some states. And then the second thing is she wanted to use a doula. And none of the systems were set up in a way that made it easy for her to get access to and use a doula inside the medical healthcare system, the insurance system, any of those things. Like we just haven't built guardrails that help folks have as much choice in the way they want to give birth and be pregnant, and access to the tools to do that the way they want to, the way they dream of their pregnancy happening. And that's been very frustrating for my daughter.
With you saying that, in Nevada, we've been working in the last 3-4 legislative sessions to address just that, establishing policies to create freestanding birthing centers that are actually run by midwives with doulas in there, but they have to be attached not to a hospital, but to a licensed clinical professional, but freestanding. My daughter decided not to give birth in a hospital. She was going to give birth at home in a pool in her living room. And I thought she was nuts until I was there with her. And I realized that was such a better option. She had her midwife, she had a doula, she had a midwife in training with her, but she had already registered at a hospital. So if she needed any emergency care, they could have transported her to the hospital because they had that transfer contract. Much easier birth for her, giving birth to her first baby than me giving birth to her when I had her. My doctor told me I wasn't in labor, that I was just having some pains. It's your first baby. Don't worry about it. You're not in labor. And I told him, well, I'm getting on a road trip from California to Arizona to visit my mom. Don't worry about it. You're not in labor. I get on the road. My car breaks down. I'm in full-blown labor. Thank God there was a trucker and his wife that understood what I was going through. They helped me get back to Indio, California to have my baby. They fixed my car and brought me my car to Indio. But I was traveling with a friend, not my ex-husband. The friend happened to be a white man who was helping me get back to Arizona. And the nurse at the hospital, we realized, was someone who didn't appreciate interracial relationships. Now, he wasn't a boyfriend, he was a friend, but the only way I could not be in that room alone, he had to lie and say he was my spouse. And once she realized that there was a white man with me, she no longer came in the room to give me treatment for the rest of the time. So
Oh,
I went into
wow.
labor, had the baby. She never came back to check on me. My stomach blew up, my blood pressure went low, and I coded because there was a nurse that didn't appreciate the relationship she thought I was in and was willing to let me die.
Oh
So
my goodness.
very big difference in her being at home in a pool with all her friends and everyone around her in a hospital setting where literally she could have lost her mom and my parents would have had to raise my baby.
That's insane. I thought I had a birthing horror story, but I think you got me beat. Yeah, that's
I
wild.
the sad thing is I think there's so many women, and especially Black women,
Yes,
women of colors that have a birthing horror story.
yes.
And that shouldn't be the norm in our country.
No, it should not be.
No. And the thing that happens is like the horror stories that you went through, that my mother went through, my third child was a very sick child who they spent a lot of time not being able to figure out what was wrong with him until a Black nurse saw him and said his skin color isn't right. And all the white folks who'd been working on us had ignored the fact that my husband and I were both saying, why is he that color?
Wow.
And it wasn't until she came in and said he should not be that color. Wasn't getting oxygen. That's why he was that color.
Oh, wow.
Yes. And she saved his life. But it shouldn't be that way. And we should be training our medical professionals to care for people who are different from them, giving them experience working with patients who are different from them, and to look for things that they may not know to look for based on their own upbringing, their own history, and the sort of Eurocentric way they have been taught to do medicine. And one Black nurse saved my boy's life, and
Hmm.
thank goodness for her. But the fact that we are still having these conversations and still dealing with these sort of issues years and years after I dealt with my son's 21 years old, years and years after my mother dealt with her issues, and my grandmother who lost babies in childbirth, like all of these things we should have fixed. We are the kind of country with the resources to have fixed them, but still here Black women sit sort of at the bottom of the pile when it comes to fixing issues like this. And we and our daughters continue to deal with this. And now our daughters will have fewer rights when it comes to our bodies than we had. The backwards going that we're doing is as frightening as anything else.
And I'll tell you, we're talking about what our grandmothers went through. My grandmother had a saying about childbirth, that when you're in labor, you've got one foot in the grave and one foot on a banana peel.
Oh, wow.
And I didn't understand that until I was in childbirth. I'm like, oh my God, am I gonna die? This is, 2000, the year 2000, and here I am with one foot on a banana peel. And not much has changed. And that is, I mean, it's unacceptable. It really is just unacceptable.
Yeah.
That's the only word that comes to mind.
Are you hearing in your states what I'm hearing here with Black women saying, I'm just not heard? And it doesn't matter what economic status that they're not listened to by their physicians. Are you
Mhm.
guys hearing the same things in your states?
Mhm.
Absolutely. I hear from women who feel dismissed by their physicians, whose pain is ignored by their physicians. And even, another example, my daughter, when her son was born, she had to bring in an advocate, might have been me, to help make some noise about the fact that they had done something and they needed to fix it. And the fact that they
Mhm.
just wouldn't listen to her. She's like, this is how it's been this whole time I've been here, Mom. They won't listen to me.
Well, I'm encouraged that, during my second legislative session, I passed the Maternal Mortality Review Committee bill. And at the time, our now vice president was in town visiting. She's like, hey, I worked on that bill in DC. Let me help you. And she was willing to. I thought she was just joking, but no, she had her staff reach out and call me and help me get that bill passed. I'm so happy and encouraged that it's her that we have as our vice president, because it's going to take us as Black women being advocates for each other,
Mhm.
so that people can be heard. My situation, Crystal's situation, your daughter's situation, what would have happened if we didn't have an advocate there with us to speak up? So we have a huge responsibility to play it forward for that next generation, because we know if Donald Trump gets back in the White House,
Yeah.
we talk about an abortion ban.
Yeah.
There would be a nationwide abortion ban. We talk about us not being listened to and not heard.
Yeah.
He's a man that doesn't listen to anyone, especially the voices of Black women. Having President Biden in the White House with his vice president who truly understands and listens, he's a white man that says, I don't know everything. Let me listen to these Black women. How can I help them? Right.
Right.
So I'm encouraged to have that, but disappointed to see what's happening in some of our red states, as in my old home state where I was born and raised, Arizona, going back to an 1864 law. Come on now.
Right.
What else happened in 1864? I don't think I was recognized as a full human being.
Exactly. And that's the part of it. That's what we've always known what MAGA means, making America great again. Where did it look like for Black America when America was great?
Right.
Great.
Right. The great times of 1864, not so great, right?
Yeah.
I think as we think about, the importance of having a vice president who understands what we're talking about and who is willing to speak up about it. Let's just talk a little bit about how great she has been at being everywhere, talking about the issue of women's health, talking about Black women, talking about the abortion bans and the importance of the work that they are trying to do in DC, and really lifting up these issues in a way that, frankly, no one else could the way she can, because of who she is and the community that she comes from. It's so important to have a voice like that, and we haven't had that voice previous to the vice president. And we are lucky to have her. And I think this country is lucky to have Biden and Harris. And really, such an important thing that we need to keep talking about among ourselves and to our voters is the difference that this administration has made in the lives and will continue making the lives of Black women in America, and of course, all women in America, and the importance of having Vice President Harris on that ticket. So vital to making sure that we continue to make life better for Michiganders and Americans, not worse.
I agree with you completely. Agree with you completely. The ACA has been there, for so many families, Black women, families of color, and having Trump in the White House, the thought of families losing their medical insurance and so many Black families losing their medical insurance. And we were so close to it the last time he was in the White House. He would definitely take it away. And Crystal, I feel so sorry for you in your state where you didn't have Medicaid expansion.
Thank you for the sympathy. We appreciate it.
Yeah. I can't imagine what that would do to families here in our state to lose their medical coverage. It would be devastating. And when you talk about pregnancy and being pregnant and being a mom, it starts long before that. I mean, it's so much more than just actually giving birth. It's living in a community where you have food deserts, where you don't have accessible to a doctor or a hospital. It's the unhoused, we talk about housing conditions, all those things play into a part of having healthy mamas and healthy babies. So we do have, as you said, Lavora, a vice president who understands that, a president who understands that. I feel kind of guilty being on this call. Crystal always says I'm spoiled. I live in a state where, we have Medicaid expansion and we have the freestanding birthing centers, and Nevada's a safe space. If a woman wants to come here and have an abortion because her state won't allow her to do it, she can come here. And doctors are protected here in the state as well. So I kind of feel guilty. I feel we're doing things right. Want to help everybody else in every other state get it right and follow Nevada's lead. But we can't take anything for granted. So, we have a ballot initiative to make sure that, it's the access to abortion is protected in our Constitution. And I think with everything going on around the country, although it's in our statutes, voters here understand that could be taken away.
Anytime.
No matter, by just a change in the legislative body, by a change in your governor. So we're fighting hard to make it a constitutional right in this state.
That's
No,
great.
that's smart. That's the conversation we have to have about how easily they could roll back the rights that we've all fought so hard for. The hard work that's gone on in Michigan here to get us where we are was led by, of course, a terrific Democratic governor and a Democratic trifecta in the legislature, all of which could get rolled back if we let the MAGA Republicans come back and take control, or if we let Donald Trump win.
That's how they roll, right? They roll it. It's serious here. They really, I feel like, work against what's best for South Carolinians. At every level of government here, it's pretty bad. But the Democrats here are fighting. We did have a Democratic representative last year or 2 years ago who put a bill up to allow bias training for labor and delivery staff, right? Like that should be something
There you
that
go.
passes, right? Well, the Republicans, of course, we're in the super minority. The Republicans amended it to let's just do a study first. Let's do a study. That didn't even pass. It passed the House, but then it didn't pass the Senate, so it failed. So we do have Democrats here who are fighting back. But it's a uphill battle for us all the way.
That's really sad. We have a women's majority legislature in Nevada, the first and only.
Nevada got it going on.
Got to put that plug in. But we're constantly, singing to the choir and singing to anyone who will listen that healthcare is not partisan. Access to quality, affordable healthcare is not a partisan issue. It affects everyone. When you get sick, they don't ask you when you go to the hospital if you're a Democrat or a Republican. The disease that you got doesn't care if you're a Democrat or Republican, right? This is not a partisan issue. And I do not understand why my colleagues that I serve with in the legislature have taken some of the positions that they've taken, and nationwide, why the Republican Party is standing where it's at. Healthcare it doesn't care. It doesn't care what party you're in. And we have a responsibility as a country to be there for the least of those in our communities. And we have seen when it comes to childbirth and maternal health, Black women are hurting and dying at higher rates. So when you talk about taking care of the least of these, we really need to enact policies nationwide that take care of the least of these. And oftentimes that's us.
100%.
Beautifully said. Beautifully said. And as long as the Republicans in our legislatures are following the lead of Trump and the MAGA Republicans, they're never going to recognize that healthcare is not a Democratic issue, because the top of their ticket doesn't want them to recognize that healthcare is for everyone, and that this country was built on the backs of people who now occasionally need some help and don't get it because of politics. Don't get it because of the way that we have structured our healthcare system to make it harder for people who don't have to get what people who do have are able to get access to. And I think that a lot of the MAGA Republicans just want to keep it that way because that's the way the top of their ticket wants to keep it.
Mm-hmm.
So
Exactly.
Christale, got a question for you. Since the Dobbs decision, what can folks in your state do to get involved in the fight for reproductive rights? And how can we help you?
They can join organizations like Planned Parenthood. Their membership is free. They can go to local Democratic Party meetings. They can, come to state Democratic Party meetings. And right now, South Carolina does not have a citizen-led ballot initiative, right? So we can't just put initiative on the ballot, to say make abortion legal. That has to come through the General Assembly, and the Democrats are in a super minority there. But they do have a big petition effort going, in just the hopes to try to show these Republicans across the state, like, abortion is this is a deeply unpopular issue, and try to show them by district, like, here are 3,000 voters in your district that support women's reproductive rights. So those are some of the things that they can do, like just kind of get involved locally. You can get involved at the state level. But those are the things at this moment that they can do, and just push back on their legislators.
Awesome. Well, we're getting close to the end of our time for this, ladies. Any final words? And thank you so much for hopping on this Zoom. for the first time in the Democratic Party history, we have 7 Black women leading state parties as chairs. So I wish they all could have joined us today, but they couldn't. But we'll have other opportunities where we can
Yeah.
gather. But any final words?
Yeah, I will just say thank you both for joining me and having this discussion and lifting up this important issue. I think that the three of us and our sister chairs from other states have an opportunity now to help lift up and keep in the public eye important issues like this one for our communities, and we should continue to do that together. And I thank you both for being part of this discussion with me today. I loved it.
Absolutely. Same for me. Thank you so much for including me. I think these are very important discussions, and we need to definitely keep having them as this cycle rolls on. And even, in the off cycle, we need to make sure that we're continuing to talk to our voters and make sure they know what's at stake and what's going on.
All right. Well, I'm going to give you the rest of your day back. I know we all have a lot of work to do. We got a lot of Democrats to get elected from the top of the ticket down up. So